Can we do laparoscopy for infertility? Is laparoscopy indicated for infertility? Yes. Laparoscopy for infertility is generally done or performed after all the fertility test has been done and the result doesn't conclusively give us a diagnosis. In other words, we have done all the tests which are non-invasive and we couldn't get to answer the question why there is no pregnancy. Therefore, to look for this cause of infertility, laparoscopy may be the last line of reaction. Compared to other surgical procedures that can help to get the diagnosis of infertility, laparoscopy usually is less invasive method. There's lower risk of infection, the smaller incisions on the abdomen, and the quick recovery post the procedure. In this case, most commonly what we call chromoperturbation is done, which is actually looking at the patency of the tube life and seeing that actually the tubes are open, and during that process other things can be looked at. What are the risks of laparoscopy for infertility? Yes, there are risks involved there. Internal bleeding, infection may happen, damage to any internal organ that can be bladder, ureter, and bowel, and so forth. And the poor healing of incision and the scar in the abdomen can be seen as well. What are the findings, or what is it that we should be looking for when we're doing laparoscopy for infertility reason? Firstly, we have to look at the uterus. Preferably myself, I do hysteroscopy as well to make sure that the inside of the uterus is clear, there's no problem. Therefore, what you call laparoscopy and hysteroscopy. But during laparoscopy, I'll really concentrate on the uterus itself. Look for fibroid, adenomyosis, and look for adhesions, and look for fallopian tubes, blockage, hydrosalpinx, and even tubal patency and adhesions. Look around for the ovary. Therefore, you can even pick polycystic ovary, any ovarian cyst, any adhesions around the tubes, atrophy of the tubes, endometriosis, and endometrioma can also be seen in the ovary. Person with pelvic inflammatory disease as well may also present with what is called a frozen pelvis. And in that process, you look also for deep infiltrating endometriosis. By definition, it's endometriosis in the uterus, in the ovaries, and in the bowel, in the ureter or the bladder. Therefore, yes, laparoscopy can be used as the last line of investigating the cause of infertility. However, we should weigh a laparoscopy against with a complication which may follow. In some cases, definitely it can give us the answer and probably help us to get to conceive. Thank you.